stalker in the confines of my home. I'm the production coordinator here at WestfordCAT, and I am Zoom chatting with Westford Health Director Jeff Stevens. How are you doing, Jeff?
Doing fantastic. I am holed up in my office.
Are you getting any sleep?
Well, I'm getting as much as I can when I can, but my department's working pretty much 15 to 16 hours a day, trying to maintain the communication line and making sure that we're keeping in touch with any of the positive cases that are in town, and just doing the general public health work that we regularly do.
Well, we really appreciate it. Thank you so much. You guys work really hard, and it's good to know that you're in the corner taking care of Westford's health. So I want to just ask you a few questions, Jeff. So how many, as of this point right now, how many reported cases are there in Westford?
Right now, there are 8, but a more important number is really the Middlesex County number, and that's 538 cases as of right now. The state generally only reports by county, and if you go on to the Mass DPH website, you can actually find that information. It will break it down by county, male, female, some other information that is actually really helpful for people to see on what some of those demographics are. I'm actually just pulling it up on my screen so I can give you some of those types of things that they have. In the Commonwealth right now, as of yesterday's reporting, was 2,417 cases, 538 in Middlesex County, 1,218 were male, 1,197, I'm sorry, reverse that. Female were 1,218, male were 1,197, unknown were 2, and then they also do break it out by age group. And one age group that is kind of noteworthy to pay attention to is the age group of 30 to 39 years of age, where they've got 433 cases in that age group. And then the 50 to 59-year-old age group has 437. That's really kind of concerning that those age groups are people that are out a lot, and some may feel that they are immune to this. Mm-hmm. But according to the state's data, that's pretty clearly not the case. There's one number I like in this particular data where I think the social distancing that parents have been doing with their kids is great. Children under 19 years of age, there are only 53 reported cases in the Commonwealth right now. And that's kind of great news, because that means that social distancing for that age group seems to be working right now. And hopefully we can keep that trend going and that number doesn't grow.
But isn't it sometimes the younger age group don't really experience the symptoms as severely? Can that be part of that?
There's a possibility that is. I mean, there are people that have tested positive that have not had any symptoms. Mm-hmm. And that's very frustrating for the epidemiologist, because it just makes this that much more complex. And how do you diagnose it?
What should people do if they are exhibiting symptoms, Jeff? What are the steps they should take?
Well, if you are exhibiting symptoms, which is fever, cough, shortness of breath, the first thing you should be doing is contacting your healthcare provider. And I would stress that you call them. Do not go to their office. Call them and tell them what your symptoms are. They will then direct you on what they would like you to do next. That's probably the most important thing.
Where are the local testing sites?
So they are testing at Emerson Hospital and they are testing at Lowell General, but they are only testing, to my knowledge at this point, for people that have doctor's orders to be tested. And there is a hierarchy of testing. They are testing first responders first, and then high-risk patients, and people with mild symptoms are lowest on the list.
Do you know if those are drive-through tests, or do you have to go in?
I actually do not know about Emerson. Yeah. I do believe they're standing up a drive-through testing facility in the area, but I haven't been given information on it yet.
So what if someone who's like self-quarantining or, social distancing, elderly, or just someone who can't get out to the store to get the supplies that they need? What is there anywhere local in town that could help someone?
Well, in Westford, there is. I mean, first and foremost, if you can use friends and family, that's great. But make sure they're not sick and they're not putting themselves in risk to help anybody else. That's number one. But if you don't have any options, and if your entire family happens to be quarantined, you may be able to get some assistance through the senior center. If you're able to contact them, their number is 978-692-5523. They're working in conjunction with the Upper Merrimack Valley Medical Reserve Corps, and they are delivering certain things to people that need it, and they've been really good at getting some of those services done. Additionally, if there are students in the Westford school system that need to eat lunch, the school system is providing lunches to families, and the lunch program will be able to help you out there, and maybe getting a week's worth of lunch supplies on Mondays. If you are interested in that, I would recommend calling the school system. Their number can be found on the Town of Westford website, and the food service will be able to help you out.
That's really terrific that they're thinking of everybody in that way. That's great.
Yeah, everybody's come together in town. They've worked really hard. I'm proud of everybody in town. All our first responders, all our leaders are trying to pull together to get everything we can done.
I know, I can see that. It's really great. Well, so what businesses are open and which ones are not?
So yeah, there's a lot of people that are concerned about that, and there's a governor's order on what can be open, and there's a document that you can get, and it refers to what are the essential services. And I'm just gonna, because there are a lot of categories, I'm gonna just read what they are, because the categories are sometimes a little easier to follow than a specific job. So first and foremost is healthcare, public health and human services are essential. Law enforcement, public safety, first responders, people working in the food and agriculture industry, energy, petroleum workers, not that we've got a lot of oil rigs in Westford, but workers are definitely in that category. Natural
We've
gas.
got an asphalt plant coming soon.
We do, but they're not online yet.
Okay.
Steam workers, water and wastewater, transportation and logistics, public works, communications and information and technology, and other community-based like essential government operations like security staff, hotel workers, people that are working maybe at banks, educators and staff supporting distance learning, critical manufacturing, hazardous materials work, financial services, chemical workers, and defense industrial-based work are really the categories.
So it looks like you and I are working.
Exactly. We are definitely working. We're the communications piece right now.
I'm happy to be working. I will tell you that. So what is the CDC or the World Health Organization? What are they predicting long term for this?
Well, I don't know that they can predict super long term on this, because it's still unfolding and evolving, in my opinion. And I do feel that we're in for another several weeks of waiting to see how this will shake out on when the United States kind of gets to the top of the bell curve, if you will. Mm-hmm. And I think what the CDC and the World Health Organization are really trying to do is tell people what the best practices are and the things that they need to do to try to help, as we're getting to learn this term, flatten the curve. Mm-hmm. The whole purpose of doing so is to make sure that our healthcare system can handle the people that are sick when they're sick, and not putting too many people in the hospital at the exact same time, which would be pretty devastating.
Yeah, New York's struggling right now.
Yeah, they are.
So what should people know that perhaps we haven't touched on?
Well, I think some of the things that people need to pay attention to is, if you're sick, stay home. If you live in a house with somebody that's either confirmed or presumed positive, you're going to be quarantined. You're most likely going to be contacted by a state epidemiologist or your local public health nurse, who is doing the outreach on all the cases in Westford. And I'll just put a plug out to Gail Johnson. She's doing a great job at it. And people need to realize this threat is very much real. People are getting sick, and the numbers are going up quite a bit every day. Part of that has to do with the amount of testing that is going on, and that certainly is showing how many people have been sick. And people need to just make sure they're following the rules. Make sure you're washing your hands, you're covering your mouth, you're staying home if you're sick, you're using hand sanitizer that is at least 60% alcohol when you buy it. And I know that's tough to get. One thing I'd like to do and ask people if they have the ability, there are people that have lots of medical supplies. If you've got extra, such as N95 masks, if you've got extra gloves, if you have extra hand sanitizer, your first responders are the first ones on the line trying to help you out. And what I'd like to make sure that they can do is have the supplies that they need at any given time. So we're more than happy to take donations at the health department here in Westford, and the police and fire are happy to take them as well. If people want to get in touch with our office about donations, my number is 978-692-5509. Or you can email me at jstephens@westfordma.gov. And we can arrange a time to pick those supplies up, and we'll just thank you in advance for anything that you can do.
That's great advice, Jeff.
The last message I really want to give people is just to stay positive, stick with the rules, and I think we're all going to get through this just fine.
Thank you, Jeff. I know you're really busy. I really appreciate you taking the time to talk to WestfordCAT today, and stay safe, and we'll touch base again, okay?
Absolutely, and thanks for having me on.
Okay, take care, Jeff.
Thank you.